Thank you. Good evening, everyone. Welcome to tonight's meeting. I'm Councillor Helen Rowbottom. I'm the chair of the Children and Education Policy and Accountability Committee, and it is our January finance round again. So as custom, we are, for the purposes of efficiency of everyone's time, holding this jointly and analysing the health and adult social care and the children and education budget, but we'll take those segments separately. Before we start, just a few housekeeping points. So by attending and participating at this meeting, you're consenting to being recorded. Please can officers and our guests introduce themselves when they first address the committee. And if the fire alarm sounds, please leave the meeting in an orderly fashion by the staff fire exit, which is behind me to my right. I think if I was actually pinned on exactly where the fire exit is, I'm not sure I'd be 100% sure, but many people in the room do know. So look to them. I know that we've got a lot of people in the room, and it's my custom, I don't know about health and adult social care, to go round the room and introduce everyone, but I think it might be worth it just so we all know who each other are. So I will start most importantly at my left with Councillor Perez.
Good evening all. I am Councillor Natalia Perez, Chair of the Health and Adult Social Care Policy Accountability Committee.
Good evening all. I'm Councillor Genevieve Warbeck and I'm one of the members of the Health and Adult Social Care Committee.
I'm Councillor Lydia Painter and I'm one of the members of the Health and Adult Social Care Committee.
Good evening, everyone. My name is Councillor Darrell Brown. I'm the Deputy Mayor and I'm on the Children's Committee as well.
Hello, I'm Lucy Boddington. I'm a co-optee on PAC.
Hello, I'm Jim Greeley. I'm a co-optee. Sorry about that. Let's start again. Hello all. I'm Jim Greeley. I'm a co-optee on PAC.
Good evening, everybody. I'm Sarah Bright. I'm the Director of Commissioning, Transformation and Partnerships for the People's Department.
Hi, everyone. I'm Mayada Awafan, Interim Director of Public Health.
Yeah, hi, everyone. My name's John Morley, the Interim Director of Adult Social Care.
Good evening, everybody. I'm Prakash Dharanani, Head of Finance, covering Adult Social Care and Public Health.
Good evening, everyone. I'm Tony Burton. I'm the Head of Finance for Children's and Education.
Good evening. I'm Jackie McShann, Executive Director for People and Director of Children's Services.
James Newman, Assistant Director of Finance.
Pete Aylock, Director of Education and SIND.
I'm Sarah Sanderson, Operational Director of Children and Young People Services.
I'm Councillor Bora Kwan, the Cabinet Member for Adult Social Care and Health.
Good evening, everybody. My name is Councillor Rowan Ree. I'm the Cabinet Member for Finance and Reform, and I think, unfortunately, you're going to be hearing an awful lot from me later on in the meeting.
That's all right. We can nudge you if you're talking too much. Good evening. I'm Councillor Alex Anderson. I'm the Deputy Leader.
Good evening. I'm Nandini Ganesh, co-optee PAC.
Good evening. I'm Councillor Alia Afzal Khan, a Councillor for Palace and Hurlingham Ward.
Good evening, I'm Councillor Jackie Borland and I am a member of the Health and Adult Social Care Policy and Accountability Committee.
Hello, good evening. I'm Mercy Ume. I'm Education Committee panel. So.
Hi, I'm Liam. I'm the clerk.
Brilliant. Thank you so much. I should have really stressed at the beginning that I will be co-chairing tonight with Councillor Natalia Perez, so apologies remiss on my part for not stressing that. We have received apologies for absence from Victoria Brignor and Nadia Taylor. Any other apologies that are known? Got a very full house otherwise, so I think we're otherwise good. Fantastic. Item 2, declarations of interest. Do members have any declarations of interest? No. Perfect. Thank you so much.
Thank you very much. And we now move on to agenda item number 3, minutes from the previous meeting. So the members of the Health and Adult Social Care Policy Accountability Committee agreed to the minutes of the meeting held on the 17th of November 2025 as an accurate record.
Agreed.
Thank you.
Perfect. And similarly, do members of the Children and Education PAC agree the minutes of the meeting held on the 3rd of November as an accurate record? Brilliant. Thank you very much. Okay, item 4. As mentioned before, we are holding this meeting jointly, but what we're going to do is have the presentations all together, and then we will split for the kind of scrutiny bit of each separately, and we will chair that separately. So also want to say at the beginning, we're very mindful of officers' time with the SEN review, so we're going to have full time to explore, but be kind of efficient and try and get you home as quickly as we feasibly can. Welcome very much as well to our new staff members who are here since I last chaired a meeting, or at least first time I've kind of met you properly. So welcome and thank you for joining us. I will go to Councillor Rowan Ree for the first presentation.
Thank you very much, chairs, and thank you very much, members of the two committees. Thank you very much for having me here this evening. I'm particularly pleased that we're able to meet jointly today. Firstly, because I think it gives a good illustration of the internal reorganisations that we've been doing as a council in order to make sure that we're operating as efficiently as possible by being able to have the two committees representing the People's Department or covering the People's Department here on one evening. I'm also particularly pleased because these are my two favourite committees, so the chance to get to meet you both at the same time is always a joy. Last but not least, the fact that we're all in one room. Next week, James and I are going to have to put our running shoes on to move between two committee meetings here and in Clockwork. So to be able to do all of the meetings sitting down is great. So thank you very much for that. So in this presentation, I'm just going to be going through, firstly, the strategic context, the background for the setting of the budget. I'm going to talk through some of the changes in this year's budget, and then we'll finish off with some of the next steps in order for passing the budget. You'll all be familiar with these after 4 years of budget setting. Then we'll go into some of the detail from the departments about the specific changes that will impact people. So in terms of the strategic context, we really start, I think, with the Chancellor's budget back in, I think it was November. This really helps us, the figures from the budget really help us in terms of setting our assumptions for service use and where money is going to be needed over the coming year. So from the budget, we saw that there is going to be a modest increase in growth, 1.5%. It's not as much as I'm sure the Chancellor would like. It's certainly not as much as we'd like. But the fact that people will have a little bit more money in their pockets is generally good news. Inflation reducing as well, down to 2.5%, getting close to target. Low inflation is a good thing for us as a council. It means that the changes in contract pricing are slightly more affordable. Just for context, a couple of years ago, this was at over 11%. So 2.5% is good and heading in the right direction. Interest rates as well, we've seen coming down. Hopefully, we're going to see another couple of decreases over the following year, and a fairly stable picture in terms of employment prospects. The more people who are in good jobs, the less support they need from the council, and so the less money we need to spend on certain services. We've seen a number of changes announced in the budget to the local government sector. The high value council tax surcharge was floated. Now, although it's described as a council tax, it's not a council tax. We're responsible for collecting it, but we don't keep any of the money. We've also seen added investment in schools, the free breakfast programme being funded. That's something we're particularly proud of here in Hammersmith and Fulham, as this is something that we introduced as a borough. It was taken up to London level. It's now been taken up to a national level. So that shows the difference that the policies that we fund here in Hammersmith and Fulham can have at a wider level. Also, we've seen changes in the housing rent convergence formula, which will ease some of the pressures that we have in our housing revenue account. We also need to take account of changing demographics and legislative expectations of councils. They say demographics are destiny. Well, most of central London are seeing a slightly ageing demographic population. This obviously has an impact on the demand for social care services, and the changing demographic shows that there are changing needs within the borough. That's something that we need to be alive to, and when it comes to forecasting demand in the future, that's something that we certainly bear in mind. Finally, I think something else that we should be aware of is some of the local regeneration schemes. Most notably, of course, sorry, the industrial strategy in the north of the borough. So although national economic growth may be fairly stagnant, here in Hammersmith and Fulham, we're seeing huge amounts of growth in the north of the borough in particular. We've seen over £6 billion of investment in our borough through the industrial strategy, creating over 17,000 new jobs. This is exactly the sort of boost to the economy that helps us as a council because more people have got more money in their pocket and they need fewer services and less support from the council. If we could move on, please. Thank you. The next slide is covering the fair funding review. Now, this is particularly important when it comes to setting our budget. This is the changing way in which local councils are funded. So there's essentially a pie of local government funding, and the government decides how that gets sliced up, how much each council gets. The fair funding review is something that's been kicking around now for over a decade. We've finally seen it being enacted. Now, we've always been fairly wary of this. You know, the way that this is put together isn't particularly helpful to Hammersmith and Fulham. And to be honest, that's what we've seen in the figures that we've got out of it. Just to sort of explain how fair funding works, essentially, it's a big formula that the government will plug in all of the various numbers from local authority areas, and then they get a figure at the end, which is how much of a grant each council gets. Now, Hammersmith and Fulham doesn't do particularly well out of this. We are not particularly happy with the settlement we've got. We've made representations and we'll be making further representations. This is a provisional settlement after all. We'll be looking to make sure that Hammersmith and Fulham gets its fair share. But just to put it into context, of the 296 local authority areas in the country, Hammersmith and Fulham is the 120th most deprived. So it's not as if we're living in Dickensian conditions, but the streets aren't paved with gold either. There are 60% of local authorities are less deprived than we are in Hammersmith and Fulham. We want to make sure that our funding properly reflects that. What we did see this year, so although we have seen a not particularly favourable settlement in financial terms, what we have got, which is useful, is a 3-year multi-year settlement. So in the past, we've had 1-year settlements, which means that year on year, we're scrambling to work out how much money we're going to get and trying to set budgets very much at the last minute. This gives us a little bit of stability. It means that we can plan for the future. And that's what we've done as part of this budget. We can move on to the next slide. Thank you very much. So this is the strategy for when it comes to setting our budget. What we've really set out to do is to have a sustainable, balanced budget. Despite the reduction in funding, we have still managed to balance the budget as we're required to do, but we've put aside money to make sure that the finances are in a stable condition. I would love nothing more to have cut taxes and provided lots of shiny new services, but that wouldn't be prudent at this juncture. This is a budget that focuses on building solid foundations for the next few years to make sure that the council is able to operate and the services, most importantly, that residents rely on and that residents value are protected. Things like free home care, things like free breakfasts for primary school children, things like the family hubs. These are all policies that are protected with this budget. As I say, it's only essential pressures that we're funding. There aren't any new services, but we're making sure that the services that we do have are funded properly. We've included money for inflation and we've provided money to meet the additional demand that I spoke about earlier. If we could move on to the next slide. And so this breaks down the figures and where the changes occur. You'll see additional money for pay inflation and price inflation. These are the contracts that the council relies on that are based on inflation. You've seen an increase because of our success in managing the collection fund. We've improved our collection rate this year, And so that gives us a valuable extra £3 million for the budget. But also we've put aside money for things like changes to the governance structures. And you'll see here almost £18 million worth of savings, which we'll go into next. We could move to the next slide. Thank you. So this shows the essential pressures that the council is facing. You'll see a big change of this is due to interest rate cuts. So whereas in the past we've received lots of extra money for the fund, the general fund through money that we've put aside because interest rates have fallen. We get less of that. I mean, that might sound like bad news, but actually that's pretty good news because reduced rates means that costs elsewhere in the budget are a lot lower. So although this appears to be a pressure, this is actually very good news. We've had to put aside money for the increased cost of concessionary fares. We've put aside extra money to make sure that we're collecting all the money that we're owed through the collection fund. And we've put aside extra money for the council tax support scheme. You'll see there we provide, if you're a care leaver, if you're a foster carer, you pay no council tax in this borough. And also this year, if you're a military veteran, you'll receive a 25% council tax cut. If we move on to the savings. So this shows where that £18 million of savings comes from. Generally, this is entirely through efficiencies. That we're not cutting services themselves. We're just providing them in a more efficient way, as we've done in the past. Because we have a longer term financial settlement, this allows us to plan for the future. We have 4 large corporate transformation programs that are going on alongside the in-year work. These focus on the workforce, the council's property portfolio, revenue generation, and the use of data and technology to streamline services. But these are the individual savings that we're budgeting for this year. And then finally, the next steps. We'll be going to all of the PACs over the next couple of weeks. The budget will go to Cabinet on the 9th of next month, and then the Council will vote on the budget overall on the 25th of February. I think that's quite enough from me, so thank you very much. I'll hand over to the department now to talk through some of the details.
Good evening again. This is the first time, as Councillor said, that we're presenting as People's Directorate, and I do so in the spirit of opportunity and optimism, the financial and operating challenges and constraints notwithstanding. What I wanted to really begin by emphasising is that we remain, as people, we are resolutely ambitious and aspirational to deliver excellent outcomes for our children, our young people, our adults, all our residents across all ages and stages. We cohere around a common vision and a set of principles that inform and underpin all the work that we do. And we privilege the voice and the views of our children, our young people, our adult users, their parents, their carers. We privilege partnership, both across the Directorate, which I'll talk about in a moment, but particularly with our third community sector partners and our statutory partners. And I hope that that's a strength that we've really consolidated as we've come together as a team. Our focus is very much on inclusion, prevention, early intervention. And when you hear from the team, that is consistent across all the different divisions. And one of the big advantages is the way we're able to come together to amplify and exemplify a willingness to learn, to listen, and to continuously improve. So, thank you. So you've met the team. It hasn't changed in your, there we go. Yeah, thank you. And I feel very honoured myself to be working with such a fantastic and committed team. There's always a sweet point between nurturing and cherishing stability. And we have some very long-serving and newer members. who have embraced the expertise and the experience of very new members such as Dr. Abu Afan and John Morley, who've joined us as our interim Director of Public Health and DAS, respectively. This team is a powerhouse of shared ambition, collaboration, and a commitment to improving lives. So I've talked a bit about people's directorates, and this, I think, probably a danger of repeating myself, but I want to just emphasise that in the context of a budget PAC, how important it has been to us to organise ourselves effectively and efficiently, to be purposeful in all our activities, to be cost effective, and to be honest and courageous in looking at what we do, how we do, what the impact has been, what the outcomes have been, and where we need to change. We don't claim at all to be perfect, but we do always aspire to be person-centred in our co-production of good outcomes, better outcomes for all our residents. We know that as a directorate, we are committed to evidencing the impact and evidencing delivery. So actually, there's very much an ethos of talk has to be purposeful, talk has to be, and conversations productive. We know that parts of the service have been a bit more disconnected, and we have focused on rebrokering relationships, and we continue to doing that. But as I again want to emphasise, there is a common thread of commitment and focus on prevention and early intervention to help direct services to those in need at the earliest opportunity. Thank you. So having talked about us as a directorate, now I'm going to go down into a silo just for ease of brigading. So in children's services, we continue to be rated outstanding for the whole of our children's services, and in particular our youth justice services. 100% of our schools, and I think it's 98% of our early years providers, are good or outstanding. And in fact, this year, our Key Stage 2 results were the best in the country, and our schools are being commended by government. We know that the outcomes for our children with special education needs and disabilities are better than their peers across all key stages. And that's really exemplifies our commitment to inclusion and to achieving the best results. And we have worked together, when I talk about partnerships and those multi-agency partnerships, to really understand need and to mobilise and deploy our resources. And, you know, there's finite resources, but deploy them in the most efficient and effective, and we hope person-centred, child-centred in this case way. We don't just focus in children's on maintaining the 300 plus or delivering the 300 plus statutory responsibilities for which DCS is accounted for. We have very much looked at how we can begin to lead a partnership and how we can step into wider systems. And an examples of that is that we are very proud to lead the West London Fostering Hub on behalf of 8 West London authorities. And this has been a pilot initiative to recruit and retain local foster carers. And we're about to host a ministerial visit, we think, next week. And that, again, is a partnership that crosses the sub-region. Equally, in our work that we have done to support London on a sort of regional footprint to support improved outcomes for care experienced young people, and Councillor Reid talked about the particular commitment that H&F has towards them. But we've also led Sarah and her team on a protocol to support young people who are in the care system or have been care experienced, to avoid being criminalised unnecessarily and to support, again, their enhanced life chances. You've often heard me say about workforce and how much we value our workforce. Last year, one of our social workers won Social Worker of the Year. It's a national award. And this year, we were delighted when 3 of our social workers were nominated as finalists, and 1 took silver. So really, really strong performance there. And we are just hugely grateful to our workforce across the whole of people. So moving on to adults. So when I came to HASPAC last January, Those of you who are members will have heard me say that we had a transformation and an improvement journey ahead of us, something that we recognised and, again, to use that word, embraced. And that is something that we also articulate as being probably a 3-year programme. But I am pleased to say that we have moved along that journey and that we are not where we were a year ago. I am not claiming again to be perfect or for it to be in any way complete. But I do want to absolutely emphasize and reiterate our absolute commitment to that improvement and transformation. And it's taken this whole team and previous members to work together in consort. And I think that's been really, again, a very efficient use of resources. We've restructured, as Councillor Ree said, in order to deploy our capacity and to move skills where needed, without, and I hope that's really strong, without undermining the individual expertise and professionalism of the various leaders sitting alongside me. So some of the work that we've done, I talked about partnerships and rebrokering some of our engagement piece. We continue to work with health. And I'll talk a little bit more about that, but also with our third sector and community partners, Parents Active, for example. And we have continued to listen and implement. So one of the examples is the transitions team. And we are getting positive feedback from the 147 young people that we've supported this year. When I talked last year about the transformation journey, I reflected particularly on sort of 3 main elements. One was to ensure that our workforce felt skilled and supported and that the right capacity was there. We have invested in those sort of posts to provide clear and management capacity, to enable clear lines of responsibility, accountability, and to support our workforce. And we continue to do so. We wanted to look at the customer journey, and we have put in place performance and improvement oversight and scrutiny. And I'm really pleased to say that a year on, we do have significant step change in key metrics, which for us, it doesn't resolve everything, but it's a strong indicator of that customer journey being improved. And we looked at our strategic priorities, and there's been a significant piece of work done in the past year. Some of you will have been involved in it. We have consulted we've had at least 60 engagements. I think the numbers run into the hundreds of people engaged. We've been engaging with current users of adult services and future users of adult services to understand changing needs. One of the areas we talked about was there was a bit of a disconnect between practice and residents' experience and what we were commissioning. And actually part of this year has been used to doing deep dives into areas to understand what is working, what's attractive, what will be attractive in the future. Also, what is perhaps outmoded, what doesn't appeal to people anymore. As I said, that's a very detailed piece of work to be compliant legally, and to work with partners across the piece, both internally and externally. Just again in public health, Dr. Abu Afan is built on the work of our previous DPH, Dr. Lang, and we continue with our very strong commitment to zero suicide borough. And Dr. Abu Afan is also working on that programme, but also bringing that programme and looking at the wider determinants of health and how that can inform the work of the whole People's Directorate. So I'm going to pass for a moment to Tony and Prakash, experts in their field, who are going to talk us through the financials.
Thanks. I'm just going to talk you through the highlights, first of all, from the Children and Young People's budget, and then I'm going to have the next slide is looking at the special educational needs and education budget. In terms of the spend there, significant spend on the right-hand side of the chart, that large green slice, just over £15 million, is providing effective statutory interventions to keep families together. to safeguard children and improve their outcomes. And what this spend is effectively the front-facing front door social work function, which is working with families across the borough every day. In terms of, to give you a flavour of the activity that they undertake, we have within a year 727 children subject to a children and intervention under children in need, 253 episodes under child protection, and there are circa 1,300 statutory assessments completed per annum. So that sort of highlights that very sort of front-facing, directly with residents delivery through our core social work teams. Important, Jackie mentioned the outstanding on the Youth Justice Service, £1 million there spent on youth justice, and that's working with the criminal justice system and young people around a range of court-ordered and directed interventions aimed at diverting criminality, protecting the public and improving outcomes. And that's looking at approximately 120 children and young people allocated, worked with per year, looking at the 24-25 activity levels. The large item in purple towards the bottom left, this is looking at the statutory interventions around settled and loving care arrangements, particularly for children looked after. That's delivering statutory responsibilities for approximately 200 children, just under now, children who are looked after in the borough. And just above that in the green section, just over £5.5 million spent on supporting about 507 young people in Hammersmith and Fulham who are care leavers and who we owe a duty to support them to thrive into adulthood. The other elements of the chart, we have our commissioning and other support services who are supporting functions across the Children's and Education Department. And lastly, I think Councillor Ree mentioned the food and holiday activity strategy at the top, which includes the Breakfast Club offer, but also includes the holiday activity programme, which is supported by a significant government grant of about £500,000 per annum. I'm going to whiz on to special educational needs and education. So you can see that the bulk of the spend there on the right-hand side is with respect to statutory interventions around special educational needs and inclusion. A good proportion of that is funded directly from the dedicated schools grant and the high needs block. You'd have possibly read in the news information about the high needs dedicated schools grant, which supports special educational needs provision. In addition to that, we have just under £8 million invested in travel care and support for young people in the borough with special educational needs and disabilities. On the left-hand side of the chart, the big chunk there in orange relates to early years funding. That's for the government-funded entitlements for childcare. Significant spend there for children from the age of 9 months up to when they go into primary reception age. And we expect that spend and that grant to continue to grow into 26-27 as the uptake of the full 30 hours entitlements for working parents works through for a full financial year. So an area of significant growth for Hammersmith and Fulham and across the country. Asset management, just under £2.5 million. That's administering the school's estate in terms of buildings and properties, our admission service, and it also includes our attendance function and our child employment officer work. Finally, I think we have just under £7 million on children, disabled children in short breaks. This is for short breaks for young people with disabilities. It also includes the budgets for the Haven, which is our short breaks home, and the Stephen Wiltshire Centre, which is both a resource for SEND and a family hub for special educational needs. And finally, leading on to that, we have the family hubs, which is a significant investment in 3 family hubs across the borough, including the Stephen Wiltshire Centre. And last but not least, school effectiveness, which is supporting our schools just under £2/3 and that is largely funded from the schools grant again. I'm going to move on to the next slide for, if it will let me, that is.
Thank you, Tony. So on the adult side, there's two slides, one for adults, one for public health, kind of thing around that. So the proposed budget for next year for adult social care is 122 million, or just over 122.9 million to be precise. And that's in the context of the, we've had, as Councillor Reeve has alluded to, a difficult financial settlement, provisional settlement, but we are still proposing a £3.5 million increase in the adults budget for next year. Most of that is to do with inflationary pressures still coming through in the market. Changes around the funding reform has meant that we've lost one grant, but we still managed to keep the expenditure in the budget. So there's no reduction as a result, kind of thing around that. We've got savings this time of 3.4 million, that's in the PAC, in terms of what those proposals are. And there's a centralised budgeting adjustments of just under 30,000, kind of thing around that. So they're the main changes from this time last year. So the net impact is still a £3.5 million increase in resources for adult social care. Similar to Tony, I'll move around the circle, but I'll summarise it. So from residential nursing all the way through to other care services, that's approximately £95 million of direct provision for residents requiring adult social care services. Kind of that's approximately currently 3,000 residents, just over, kind of thing, and that's 4% increase from last year around about this time, sort of thing around that. So we are supporting more residents given the demographic pressures, the acuity pressures to some extent as well in the budget, kind of thing around that. So there are pressures there, but we have found some budget provision for that, coming around that. The other main services within other care, for example, I've counted that in that 95 million, kind of thing around that, are some of our in-house services like reablement or our community equipment provider. Kind of things have been difficulties on that contract this year, but that's now smoothed through in terms of process, and a range of daycare services as well, kind of thing around that. So a significant proportion is directly spent out with residents on their care needs, kind of around that. We have, as alluded to earlier, kind of thing around that, we have some third sector provision that's been long standing, and those contracts, some of those are out to procurement, some of those are going through award process. So we're still maintaining that level of provision as part of the partnership approach in the third sector market. So those are on statutory carer service, advocacy, direct payments as an example. And under the care management and assessments are staffing based costs, all the social workers, the assessment, the OTs, the management team and the commissioning. So that's lumped together, that's just about 12% of the overall budget. Next slide, please. Now on public health, similarly to the settlement, this is now a 3-year provisional grant settlement. So from an officer point of view, it does help us to plan. And I think as Councillor Reeve has alluded to, and we welcome that, kind of around that. The provisional grant next year is 28 million. Now on a like-for-like basis, because there were some other grants added in to that, that's still an increase in resources for next year of just under 800,000, 799 mil to be precise. Because it's a ring fence grant, the pressures within that has to be managed ideally within that ring fence grant. So the inflation pressures would need to be managed within that 800,000. There's likely to be some tariff changes in substance misuse that also needs to be managed with that. And there are a small number of savings in that for public health to achieve. Notwithstanding that, on the pie chart, there are 4 main blocks of services similar to previous years, and that accounts for about £17 million of that £28 million. That's directly provided by the voluntary sector or NHS providers, kind of thing around that. So families and children services, like for example, school nursing contracts, health visiting, account for 16% of the budget. A whole range of services around substance misuse for rehab and detox, I think that accounts for 20% of the spend. And then also a whole range of sexual health services, mainly provided by the NHS, kind of thing around that. Chelsea and Westminster are our largest provider, but it can be anywhere across the country, and that accounts for 19% of the spend, kind of around that. And under the behavioural change programme, small part of the pie, but very important kind of preventative services in public health, obesity, weight management, screening services around that. Notwithstanding that, a fair proportion of the public health grant is invested in the council across a range of council services, similar to previous years, around about 30%, kind of thing around that. So, for example, in the housing, we support homelessness and rough sleepers, along with the general fund and other grants they would produce. In people services, again, we've alluded to support for fuel poverty and for supporting people residents, kind of thing around that. In place department, we support domestic violence through the public health grant as well. So they're just a flavour of the outreach of the grant that the director has sight and control over. Kind of around that. And then for running the service, there's a range of, obviously, a commissioning team and a range of officers who are out in the department that we recharge through, like, for example, there's specific business analysis support provided. So that makes up 10% of the budget coming around that.
Thank you, Rakesh and Tony. We're going to move, I think, beyond this, because actually Councillor Ree has articulated the challenges. And really what I want to conclude with is, obviously we are working in an operating environment of complexity, change, uncertainty and churn. You can see that we have very complex service arrangements. Some are directly delivered, some are commissioned from a whole range of partners. And increasingly, we work in a multi-agency way. And that requires us to have strengthened governance and structures. We need to be very stable. We need to have be clear thinking. We need to have the capacity. And we put a lot of time, energy and leadership into working with our teams, but also helping our teams connect with all those stakeholders that I've alluded to and enumerated earlier. And you can see here that we've got some of those stakeholders around articulated. We know, for example, that health has got an NHS, a 10-year plan. It's also in the middle of reorganisation with the ICB mandated to reduce by 50%. And that impacts on us because we are engaged. We're no longer working in silos. And actually the way to be effective and efficient is to lean in, not to retreat, not to build bridges, but actually to develop those relationships that matter so much and which will help us manage within our constraints, but also raise standards and improve outcomes. And I think I want to emphasize that, you know, that is that stepping up, that system-wide approach, that influencing is something that we are collectively very committed to. The poet philosopher David Whyte talks about being a half a shade braver, and I think in this new world we have to be courageous and we have to be creative. And I'm confident that we can do that. I'm not for a moment pretending that it's not a challenge and that it won't cost us time, energy, and thought. But we are very committed to transforming and reforming within the legal and financial parameters, and working with our residents to ensure that the decisions we make are based on our best understanding of need and are very close to communities. So I'm just going to leave with a final slide, which really just highlights some of those reform agendas across children's, and every single area of children's is subject to reform. Equally, adult social care, we've got the Casey review, but I've talked about our own improvement journey. And there's no area of people's services that is the same as it was or is expected to be the same as it is this time next year. So I can conclude my formal presentation, not with my colleagues. So thank you very much. And we are open for questions. Of course, I will probably going to refer to the experts on either side of me along the tables, but look forward to your inquiries. Thank you.
Brilliant. Thank you so much, Jackie, and all the wider team. And to reflect briefly, I think thank you for, you know, every time it's sort of a little bit tougher for going again and for thinking afresh and going again. It's a lot of renewed energy each time. So thank you so much. I'm going to hand over to Councillor Perez to oversee the questions and scrutiny of the health and adult social care budget.
Thank you very much. Yes, I would like to echo what Councillor Roboton is saying. Thank you so much to Councillor Ree and to all the team for the report. Jackie, I do remember when you came to committee a year ago and you were talking about that journey ahead. It's good to hear an update and what has been achieved. I would like to commend the council the proposal that you have for us. You are proposing a balanced budget whilst protecting our reserves alongside 9.5 million of efficiencies. The budget also indicates financial resilience, strong governance, and maintaining core services. So I think that's very positive to note. Thank you so much for the hard work. I would now like to invite questions from members of the Health and Adult Social Care Policy Accountability Committee. Yes, Councillor Boyle.
Thank you very much for that very detailed presentation and all the work that clearly has gone into creating the budgets. I was wondering if you could tell me a bit more about the risks about the potential increase in the older population and the costs that might bring, and how we've kind of mitigated the increased older population and the care that they are going to need.
Sarah, do you want to take the question? We absolutely recognise the growth in the ageing population. So actually, I don't know, pre-65s, we can see that there's a 29, nearly 30% growth there. And there is something about what I was talking about was understanding their needs, as well as current needs. And that's the deep dive that Sarah's been involved in. Sarah, do you want to take this, please?
Yeah, thank you, Jackie. I think it's very much about thinking very differently about how we meet care and support needs in the future, very much taken from what people have been telling us over the past year about how they see themselves as in older life and what kind of things that they would like to see as choice and give them the control over how they manage their lives best in the future. I think we've spoken also about early intervention and prevention. There is much more we would like to do by working in partnership with our community sector and thinking very much about how we create places that support people within their communities in the best way possible. We will need to transform those services, think very differently about how we deliver those services so that we can get the best out of them and meet as much need as we possibly can within those resources and be as innovative as possible. We've got lots of things like new and assistive technology. We want to make the best use of that as well. So there's opportunity to think very differently and creatively, and also think about how residents can self-direct their care in the best way possible, making the best use available of their assets and strengths within their own communities and support networks.
Thank you. And just to add on to that, is part of that deep dive, that needs assessment, is understanding patterns of uptake. You know, we are noticing that some services that were popular maybe 5 years ago, post-COVID, are not so popular. So it's incumbent on us to make that assessment about whether they can be delivered differently and in ways, I use the word attractively, but in a way that our residents want going forward.
And just on the kind of cold, hard cash side, do you foresee that being preventative and proactive is a financially beneficial way rather than having to be reactive? Is that the kind of the idea?
Well, absolutely. And actually, Maya has something to say about that. Every hour on the hour, we stand up now, we turn off the cameras and we stand up because what is it? Sitting is the new smoking, Maya. So Maya's absolutely committed to prevention. So actually they're chairs. Maya, do you want to say something about those wider health determinants?
Yeah, just to add on the prevention, I think there are evidence now we are able to slow the aging process through exercise and through healthy eating, good sleep, and we in public health working with Sarah's team and John's team working on a healthy aging program. We'll be focusing on falls prevention, loneliness and addressing loneliness and isolation, health and well-being offering care homes, improving vaccination uptake of older people. Because these are all preventative, especially in terms of just the quick wins, flu vaccine amongst older people. We saw a high increase of hospital admissions due to chest infection this year. So there are quick wins. Prevention takes time, takes 5 to 7 years, but it is cheaper. We do have evidence on if we spend £1, how much we save in terms of to the system. So hopefully by focusing on reducing the rate of aging and ensuring healthy aging, we'll be able to reduce costs.
Okay, who would like to go next, please? Councillor Painter.
On the increased, or sorry, the optimized use of direct payments, how is that being rolled out? Is that by widening criteria? Is that by increasing the amount available? I'd like to know more about what you mean by optimized. Thank you.
So our uptake of direct payments was lower than the London average. It was lower than where we wanted it to be in the national average. So we set ourselves some targets to increase that. We have outsourced or commissioned a local communities provider to work with residents around managing direct payments, which are not always that easy. So we've put time and energy into that support. That's a contract that's out for procurement, I believe, so I can't say too much about it. But equally, we recognise the benefits to residents of using that self-directed care, that choice that it brings, and not being funneled down a particular pathway. It really broadens the opportunities of residents to do what is really consistent with their interests, as opposed to what we've determined should be where they spend their time and energy themselves. So I think that's probably, unless John or Sarah want to say anything, but I think that's really essentially what we're trying to achieve. And I have to say that we are now above everybody's nodding. Yep, just before I go on record, we are now above the average, so we're pleased, but stretching ourselves more.
Jean, please go ahead.
Lucy, you're first.
Lucia.
I just wanted to ask about the independent advocates. It says that all residents have access to the independent advocates in respect to the care plans, and I just wondered how many there were, how easily available it was, if it's something that you're using to mitigate potential challenges, etc.
So I'm going to have to ask somebody for that detail. I don't have the detail, and we might have to give a written response, but John will say a little bit about the principle of independent advocacy.
Right. Thank you for the question. So if people need an advocate, they simply need to ask our services, and we will put them in contact with an advocate. There's statutory advocates that we have to put people in contact with. So these are because under the Mental Capacity Act and under the Mental Health Act, those are statutory advocates. And if somebody doesn't have a representative, then we will be expected to refer them on. We also have Care Act advocates, which are the more generic advocates that you're probably referring to. If somebody doesn't have a relative, if somebody doesn't have a friend, obviously that's their choice and they have the capacity, then we would indeed always put them into contact with an advocate.
Okay. Thank you.
Jim, please.
I must say, first of all, like last year, I'm very impressed by the fact you've managed to stay solvent after 10 years of real austerity in this area and deliver exemplary services, much better than many boroughs in other parts of London. So on that level, well done. I'd want to go back to one particular question because it won't go away, and that's the demographic growth of older people. Looking at the borough map, the number of children being born as the number of people my age, it's skewed very much. And the ICB figures, which go to the board tomorrow, show a quite startling growth in the next 5 years of older people. Now, two things occur to me. One is straightforward cost. This is a budget meeting, and how you budget going forward. And the second thing is that many of the services which are given quite admirably here to older people have heavy staffing demands. And that's in a context nationally where appropriate staff are actually just hard to recruit and even harder to retain for a variety of reasons. So I very much agree with Dr. Abufan that you could look after people going forward, say 7 years, but in that meantime, and the meantime is always the meantime, people actually need help. And it is quite right to go into prevention, but nonetheless, the cost in staffing, of looking after, of paying is inexorably going up. And I can see for 1 year how you can manage it. A 3-year rolling program sounds much better, but you must be thinking on a longer term, because locally, the figures are known by the ICB and by the joint councils working together.
Thank you. So we're seeing the baby boomers, the bulge that we anticipated 15, 20 years ago. This is a known demographic growth, absolutely. And clearly the costs across the country are a national concern. That's what the Casey Review is articulating. And we need to be realistic about the pressures and those cost pressures on us. What we want to do is, as I said, is look at how we design and deliver services. Services don't always need to be high cost. We can look at, and it's that piece about helping people choose and control where and what they want services to do. Actually, here in Hammersmith and Fulham, we have relatively low admissions to residential and nursing care. So I think that's probably illustrates that ability to support people to live well at home. We do need to think creatively because there are constraints. I'm not, pretending there aren't, or that there won't be budget challenges along the line. But if we do nothing, those budget challenges will be significantly greater than they are at the moment. So, it may feel, just given the national circumstances, that it's a bit like, King Canute, but actually we do have to work really hard we want anyway to modernize our services. We want to deliver services, as I said, that communities tell us they want. I don't know if anybody else wants to comment.
Yeah, hi. Councillor Borland, this also goes to the last part of your question when you mentioned the mitigation of costs. This is happening, as Jack just said, across the country. I think long term, the solution to this, because we're also talking about complexity, we're talking about comorbidity as people are aging. So working together in partnership, I know that's a bit of a cliche these days, but that's true. So if I was to start linking now with the NHS 10-year plan, with the drive to have care more in the community, that's exactly something that we in adult social care and indeed children's services, we can start to link into by working in partnership. So, and if I was to give you an example, if we was to have a social worker or two, or an occupational therapist or two, etc., placed alongside health workers, all of a sudden people don't have to tell the same story. It becomes very, very preventative. We get there early. We can bring in housing colleagues. So I think the key to this is that we all work a lot closer.
In fact, I meant to say in my presentation, I meant to end on actually a quote from John. This morning we were talking about things and he said, partnerships are the solution. And I think that's what I meant to exemplify in that slide when I showed moving from silo to systems. And there are challenges, but also opportunities working with the NHS, working sub-regionally, working as part of the new 13-borough ICB, and working with our communities.
But could I come back with the second, because what you said is actually quite interesting, but I'm very well aware that the NHS, the ICB locally, also faces a challenge in terms of very significant cuts to its budget, £19 per head, as against a much better figure for the last several years. And at the most recent acute board meeting about a week ago, there was acceptance that because of budget cuts there would be additional pressure on people like people across the table tonight, which is not of your wanting, by the way. And one thing came up quite interestingly. It was one figure among many, but let's pick one out. On discharge, where Professor Tim Orchard, the CEO of Imperial, and about to be in charge of all the acute boards in Northwest London, pointed out that they've got full 5 wards full of people ready for discharge at any time who don't need beds, but there isn't actual provision available within council areas to look after those people. That must be a cost for you, and certainly is a cost in terms of waiting list challenges for the acute boards. That cost isn't just to councils, it's also the NHS, and I think it's going to be very, very difficult to manage.
I think you're right. It's going to be very difficult to manage. Again, I'm going to use this word solution, because if it's a solution for us, it's also a solution for the NHS. So if we start working together, we start becoming very brave and pooling budgets, for example, because at the moment, arguments take place between social care, who are going to fund this, and health services, who are going to fund that, depending on the tick boxes on a piece of paper. Well, if we were to start talking together, and as Jackie said right at the start, to put the people or the patient or the service user at the centre and wrap around it, as they do in children's service, wrap around that person, I think there would be the solution. But it's absolutely up to us to take that forward. And often we have to lead it for people then to follow, because we have to be the brave ones.
And I would say also, Jim, there is a willingness from our health colleagues. And in the past year, we've really strengthened those strategic relationships. And we hear, people from the hospital saying, well, we are going to have to think differently. So I think the whole landscape requires everybody to think how they commission differently and creatively as well. But yeah, there's no magic solution to any of this. I absolutely agree with you.
Okay, thank you very much. Oh, if there are no further questions or comments, I just want to, yes, Mandini?
I'm not HASPAC, I'm CPAC, but can I ask a question?
Yes. Please go ahead.
I'm sort of wondering, like, most of the contracts are coming out to tender, like most of it. Will all of them contribute to cost savings, or would they give greater choice to residents? That is one thing. My real concern, as the other gentleman said, is the 13 borough ICB. And though it's very nice of you to say that you'll all work in partnership and you'll talk to each other, especially with housing colleagues, is this actually a reality? Would you be able to get a look in when it's actually going to become a 13 borough ICB? But you can start with the placement sufficiency review and contracts coming to tender.
It absolutely is a challenge, but there are opportunities within that challenge, because I think some things make sense to do at a local level. And there are lots of creative and innovative ways we can work in partnership with particularly our health colleagues to think about how we redesign and reorientate ourselves together so that our services start to align better, much as John has articulated. And then there are some things that make sense where you get economies of scale by working at a much more regional basis and get a consistency and efficiency through larger scale contracting and commissioning. So it's about that negotiation with our colleagues to be able to get that right for our residents and across both our place-based residents, but also wider than that. We know that there are inconsistencies between boroughs about who gets what and how they get it. So there's lots to play for in terms of that, and we want to get that consistency across.
The second part, Nandini, I don't know how realistic it is, but we're giving it a very good try. So for example, we have the Deputy Leader, Councillor Saunderson, on the ICB. I now find myself in meetings that a year ago I'd never heard of. So I am meeting with the Chief Exec of the current Chief Exec of the ICB and Chief Execs across North Central and North West London. And I am committed to monthly meetings. Again, a year ago, I'd have probably said, really, why me? We are also meeting with the integrator, who's also the chief exec of one of our provider collaboratives. I hope I've got the terminology right. I'm learning it all. So it goes back to my point about leaning in. You know, it is a big challenge, but we have to be in it in order to influence and also to represent our residents in Hammersmith, Fulham.
Thank you very much. Councillor Sanderson, I think.
Thank you. I'm going to be very brief because obviously this is a budget meeting, not the ICB scrutiny meeting, for which we could be here all evening if we wanted to be, because there is so much to say at the moment, which I'm sure we could have lots of conversations about, including tomorrow. The ICB, I actually met with my local authority colleagues earlier today about the ICB to talk about ways we can work together. Ultimately, the ICB needs local authorities. It needs us to be around. It needs us to be signed up to everything that they want to do with their Devo focus. So I think it's a time where there is a lot of transition, a lot of change, but as colleagues have rightly identified, there's a lot of opportunity within that. There's not a lot of clarity at the moment from the ICB side about entirely how they'd like to work, although they have just put all their job postings for their non-executive directors up. But beyond that, there doesn't seem to be that much more of a solid way forward. So we're hoping we can influence that now. So thank you.
Thank you very much. Thank you to members of HASPAC, and thank you, Nandini, for your question. I have a couple of questions. Jackie, you mentioned how this process is person-centered and the importance of co-production. I mean, with the report, we see how co-production features strongly throughout. Can you please give us some examples of where residents' feedback directly changed a service design or commissioning decision this year?
So I referenced the transitions team, which is now very embedded, and Nandini and Parents Active were very influential in pushing for such a team, and the council gave the investment across what was children and adults to make it happen. But there's been a lot of work done to ensure that the team is functioning smoothly and seamlessly across people, and I think that hopefully starts to mirror a seamless and smooth journey for our young adults. The work that Sarah's been leading in terms of those 60 engagements are all about the commissioning. Sarah's alluded to the huge contracts that we're going out to tender. There have been others more recently, smaller contracts tendering, and all of that is resident informed, and how we shape them, how we think about them, and some of that is very much work in train. So it's going to be live, and I can't really say more about it in case I'm not compliant.
Thank you very much. And the other question, I mean, I see how the People's Directorate integration is definitely enabling innovation, collaboration, and partnership working across the different departments. It's very positive. So the question is, what are the next steps as part of this journey?
Probably to reiterate that bit around trying to continue that journey of that focus on productive partnerships, prevention, early intervention, the multi-agency ecology, and helping to shape that, to try to lever, as Jim and others have said, you know, the optimum benefits, to continue to transform all our services. I think I flagged that almost every area has got a reform agenda around it. And one of the great strengths of this team is that ability to maintain a laser focus on standards and quality, while also having the bandwidth to engage with a whole range of partners around some of the difficult reforms that we're tasked with delivering. Thank you.
Thank you so much. And to reiterate, thank you so much to you and to the team.
If I may jump in on that one as well, Chair, I think that point on prevention and early intervention is so key, because we think about it a lot for children, but actually when we're thinking about life outcomes, we've got with this brilliant team a really unusual opportunity to think about whole life experiences and what it looks like if you can intervene at the right level at the right time. There's a stat that I often like to quote from the Anna Freud Centre, which is that 50% of people who go on to have ill mental health in later life show symptoms by age 14, 75% by age 21. So if you can intervene early, you can make sure someone's got the right support systems around them. That means they can, in theory, have a much happier, healthier adulthood. And I think what you've got here is a team who can work in that way and think about those whole life chances. I think that's something really unusual and quite special that we have here. So that's a big focus for us. Thank you.
Thank you so much. Yes, importance of early intervention and prevention. Okay, thank you so much. I would now like to hand over to Councillor Robotham to oversee the discussion on the children and education budget.
Brilliant. Thank you very much, Councillor Perez. I recognise that there's always a degree of overlap in some of these questions, but opening the floor now to questions on the children education budget specifically. Nandini.
I was just wondering, I mean, I'm hoping I'm wording it okay, but how is the proposed SEND reforms and stoppage of the statutory override in March 2026 reflected in the budget?
That's an interesting question because we haven't actually got the SEND reforms. And in fact, we were due to meet with the DFE, was it last week or this week? And so they haven't been announced. We can anticipate some of it, Nandini. We also have had feedback from our DFE advisor on the progress we've made towards that early identification and engagement with children, and both at an early years, but also at an early stage. Part of our work, as you will know, is around that sufficiency piece, and we are committed to developing local, high-quality local provision. Peter can say a little bit more about that. We have progressed. So actually, over the last year, we have opened 2 units and more on stream. So we don't yet know what SEND is going to. Obviously, we would like more money. But we don't know that it is. Certainly, we continue to be working again in partnership. I feel like I'm slightly repeating myself, but actually to develop sort of creative solutions. Sorry, a minute, Nandini.
I feel you're not getting to the point of what I'm trying to ask. I think there's something called statutory override. Yes. Where I think all the councils have gone over and above their designated school budget. Yes, and that was not reflected in the balance sheet up to now because of the statutory override.
Yes, yes, that's
but
correct.
From March 2026, that's going to be stopped, isn't it?
I don't think so. It's 26.
Yes. So the statutory override, which is the government mechanism to deal with high needs block pressures nationally, that has been extended until the end of March 2028. So the statutory override is effectively, it's a way of ring fencing the education budget on local authorities' balance sheets. And so that will be in place until March 2028. What will happen?
Sorry, is it 2026 or 2028?
It's been a 2-year extension to March 28. But what we do know is that with what we expect rather with the the SEN reform agenda, which the government are yet to release, that those questions will be addressed in terms of funding up until the end of the statutory override, and then the mechanisms for the high needs education budget post April 28. So a lot of detail to come, but we don't have it yet.
Thank you. Councillor Khan.
Yeah, just on the back of Nandini's question, I wanted to ask one as well about SEND, and given the the high needs dedicated school grants fund deficit, there has been a 1% block transfer request. How will the council, how will you ensure that the sustainability of the SEND provision and that the money is not transferred from mainstream schools for it continuously? And also, what progress has been made in implementing the safety valve plan?
Safety valve first. As you know, we were one of the first London authorities. In fact, we were in the first 5 or 6 authorities in the country to the tranche of the safety valve, which was a very rigorous and robust programme. and we were scrutinised and monitored on a quarterly basis. We've been submitting returns. I think we've now made our last return and we have successfully completed it. We were able to mitigate, I think, and Tony will correct me, was an 8 million overspend at the time. And that's not and bring down the historical deficit thanks to the safety valve. But that required us, and I remember questions at the outset about whether we would compromise standards, and actually the very clear steer from the leadership, political leadership, and the chief exec was absolutely not. This was not about pulling back from any of our commitment to quality, and I'm pleased to say that we haven't. It hasn't been an easy programme, and Tony will say a bit more because yes, costs continue to rise, demand continues to rise, but we're also seeing evidence and metrics of how we've been able to meet needs more effectively earlier for our children and young people.
So I think I'd just add that within high need SEND in Hammersmith and Fulham and nationally, we see continued pressure, sustained pressure, and that really is what the reforms that are imminent from government will set out the plans to achieve that sustainability, and in the course of getting there, what funding will be available over the medium term to meet SEN high needs spend in Hammersmith and Fulham and nationally. So it's obviously you'll see in the media it's a very hot topic, but it's difficult to comment really until we see the nature of those reforms. But they, I believe, are imminent. So we'll be looking at those carefully to understand how we manage within the resources available as we go forwards, linked to those reforms.
Thank you. I was just going to jump in there. I wonder, Peter, if you want to say something about our satellite sites and how we're essentially transforming SEND here to make sure we're thinking about need in a very different way.
Thanks, Councillor. So I think the first thing to point out is so growth in SEN is significant nationally, and ours is significantly below that. However, what we see within the system is not necessarily just, you have to balance it in two different perspectives. So there's growth in SEN, there's growth in autism, there's growth in ADHD diagnosis, etc. But there's also significant growth in complexity, especially in the early years. So the key things that we've been looking at is how we meet more need locally, so that we're not using significant transport costs, we're not travelling young people all over London, and we're trying to reduce our spend in the independent non-maintained sector. So what we've been doing over the last 2 years is last year we developed 3 units. So one of those is a satellite provision, which is at Sullivan, which is being formally opened next week. And that is providing specifically a provision for very complex young people with autism. We have 2 secondary units that have opened as well, one at Fulham Cross and one at Arc Burlington Danes. And then we will have two further primary units that will open in September 2026. I will need to keep the names of those schools to myself and for another couple of weeks, but soon they'll be in place. And we already have plans for another further 2 units from 2027. And all that is doing really is keeping up with the level of need that's coming into the system. So in a conversation I had before I came downstairs today, we already know that those units and provisions will be more or less full by the start of next academic year.
And just to say, obviously, that is about cost prevention. I'm not going to sit next to Councillor and say we're not really mindful of the cost, but actually it's also really fundamentally the right thing to do to keep young people close to their families, close to their support systems, being really ambitious for them and not just saying, okay, if you have some need, you have to go to a special school. We're going, okay, well, how do we make sure that every child can have their need met in all sorts of ways across our education landscape? Thank you.
Thank you. Congratulations on planning all that for the SEND provision and expanding the SEND provision, because we see nationally how the SEND provision needs to be increased and there's a huge pressure. So I think congratulations goes to your team, Peter, for doing that work and laying the groundwork for the growth in it that we'll have to deal with. On the back of that, can I ask you one question, which is, there's a sustained growth in travel care across SEND and children looked after. What is the projected growth in, what is the projected increase in the travel care costs for the next year? Do you have any figures on that you will need to accommodate?
I can say it's actually less than we projected. So it continues to grow. The growth has slowed down. It will slow down further with the units. And I know, but I don't want to quote in case I'm wrong, that it's probably a quarter lower than what we thought it was good. That would be.
Yeah, as Jackie says, we're seeing much lower growth in travel care than the national average. The investment in local provision that Peter talks about will continue to drive that. That's within a context over a number of years where the council's invested in travel care and support for SEND over a large number of years. But obviously the investment in local provision is absolutely key.
Thank you. Yeah, of course. Oh, sorry, of course.
I was going to ask the question about the 1% block transfer. So the reason that's really crucial is because the high needs block is underfunded by around £2.7 million. So if the schools block is not supporting that, it creates a huge challenge. And the people that it creates a huge challenge for is the schools. So that's why when we go to schools forum and we have that clear conversation and we provide the evidence base, that is why the schools continue to support that 1% transfer.
So what you're saying is, in effect, even though you're taking it away from mainstream schools, it is actually going back in there in a different form.
In short, yeah.
Chair, if I may.
Thank you. Yes, please do.
Okay. So I also wanted to say that there's a lot of restrictions on capital grants and how they're used. They're ring-fenced for very specific reasons. And recently, the problem that you'll all be aware of in children and education is the Fulham bilingual and the partnership probably breaking down between the French lycée and the Holy Cross. Okay, we don't want to talk about that publicly. Of course it hasn't, but I just wanted to say that because that funding is so ring-fenced, if there was a need to cover something, would that need to come from the council's general fund? And are there any strategies in place to deal with any such issues if they came up?
Thank you. This was the question that came up at the parents' meeting on Friday night for Fulham Bilingual. So obviously it's a very, very live situation at the moment. I think we've had a week to try and think about a solution to all of it. I think what we can guarantee that for every child that we are responsible for, they will have a school place and it will be funded in the usual way that all of our school provision is for our maintained students. I'm kind of conscious just not wanting to comment too much on the specific case because there's 1,000 legal things that we need to go through in the next few weeks, which is why I just wanted to be very clear on paper that the relationship has not broken down. Thank you.
Thank you for clarifying that. I will not pursue that line of questioning anymore. I'll move to the capital program. And I was wondering, there's a lot of obviously schools that are looking for refurbishment or repair. Are you planning to publish a detailed project of lists and costs that might be coming up or that are already queued up?
I'll just talk to the schools capital plan. So we have a schools capital plan which is specifically for maintained schools in the borough. So academies and free schools have a separate route through the Department of Education to seek capital investment to improve the building stock. But in terms of the programme that we have a significant capital programme which includes directly commissioned works from the local authority, both in terms of planned improvements, but also reactive maintenance programme. And it's a significant programme over 5 years. So there's a significant investment in maintained schools in Hammersmith and Fulham using those very specific grants for maintained schools. In addition to the maintenance programme, we have a significant Department of Education grant for SEND provision, which is supporting the programme that Peter talked about in terms of growing that SEN, diversity of SEN provision in the borough to meet needs meet a broader spectrum of needs locally. So again, a very significant programme over the coming year, already in train, but over the coming years to invest in our schools for them to meet SEN needs.
Have you had to make any extra bids to central government to expand that programme, given whatever list of improvements that need to be done? And how are you determining, what are the determining factors for prioritising those works locally?
So in terms of the grants available, some of the grants are on a formulaic basis, on accruing to every local authority to meet the SEN agenda. One part of the capital grants for SEN have been effectively bid for through the safety valve process. So as well as the 20.5 million of additional revenue funding that the safety valve brought the borough, we were also able to bid for additional capital grant to support that broader programme of SEN investments. So it's a mix of formulaic grant and grants that we've been able to achieve through the safety valve process.
Thank you for that.
Thank you. Nandini.
I mean, many of our special schools have children coming in from other boroughs. I mean, quite a few special schools have a lot of children coming in from other boroughs. Are we getting any income because of that?
So we get, yes, is the answer. We get two funding streams for non-resident pupils in our special schools. One is a mechanism through the high needs dedicated school grant funding, where they make a technical adjustment for net import export. So we are still a net importer, so we get a place funding adjustment for that. In addition, the top-up element of support, so that the money paid by a placing local authority to top up the cost of special educational needs, either in a special school or in a mainstream school, that is paid by the placing local authority. So we do not pay the top-up for non-resident pupils that have a place in our schools. So there are mechanisms to ensure that we pay for Hammersmith and Fulham resident pupils, and we don't pay for non-resident pupils. It's quite a complex national system, but effectively the answer to your question is no, we don't pay for non-residents in our schools.
Nandini, it's worth noting that we're a net importer for all of our schools, and I think that's just generally because of the strength of what's delivered.
And Nandini, I think you had one. Did you have one follow-up?
Just one. Do we still have the problem of falling roles generally in schools? Because we discussed that at one of the PAC meetings. Do we still have that problem?
So in short, yes. However, the early indications on the census for this academic year is that there's slight improvement in the primary roles, but we would need to see that balance out for at least 3 years. But we do have a significant concern in terms of falling roles.
Last question, I promise. How much funding has been allocated to expand or invest in the family hubs? Because there's a note that says that there'll be investment in the family hubs. Do we know how much funding's been allocated for that?
I don't have the numbers to hand. I'm not sure if colleagues do, but there have been both government investment in terms of the creation of the hubs, and there has been investment in prior years from the general fund for the revenue running costs of those hubs. Because it's not in this budget cycle, I don't have the information, but we can certainly get that for you.
We've also had around £600,000 of investment starting from April 2026 from the central government to implement the Best Start in Life plan. So that will be very much focused on the family hubs and also supporting parents and families outside of the hubs as well. So that's for young people who are under 5 as they work towards a good level of development at the end of reception.
And I just add Nandini, Stephen Wiltshire, which again, Parents Active were instrumental working with the leaders at the time to implement. Was a 6 million investment, and that allowed us to develop one of the few specialist family hubs that in the country. We think there is a minority, and we're really pleased to be one of those.
Sorry, I was just going to add, if that's okay. I said I didn't have the numbers to hand, but on the pie chart that I displayed, the Family Hubs investment ongoing from the council's budget is 1.25 million. And the ongoing investment through the Stephen Wilkshire Centre is just over £1 million a year.
Thank you so much for that. I just want to congratulate the Children Education Services team for all the work that you've put into the budget. And thank you very much for answering my questions. Really appreciate the work that you've done. Thank you.
Thank you from me as well.
Thanks, Nandini. Thank you. Any other CPAC members? Any further questions? Okay, thank you. I'll hand to Councillor Paris.
Thank you very much. Okay, so if there are no further questions and comments, we have some recommendations. Thank you so much as well for considering the budget proposals. So the recommendation that we have, and I'm going to take it in turns for each committee. So for each PAC, I mean. So for HASPAC, the recommendation is that the committee considers the proposed changes to fees and charges and makes recommendations as appropriate. Agree? Thank you very much. And now I'm going to ask the same question for members of CPAC. That the committee considers the proposed changes to fees and charges and makes recommendations as appropriate. Agreed? Agreed. Thank you very much. Okay. You want to move to agenda item number 5?
Love it. I'm going to cruise in for the item 5, dates of future meetings. So are the dates of the future meetings noted? Just to say that the next HASPAC will be on the 22nd of April and Children Education PAC will be on the 15th of April.
Which I assume won't be going ahead because we'll be in the pre-election period.
Yes, I never know where we have to do this coquettish.
Yeah.
They're going ahead, but we know they aren't.
This will be the last ones, but noted.
Okay, well, thank you. I'm a slave to process, as we know. So really excellent point there. But thank you so much for coming this evening and for really deep thinking in the questions, and much to celebrate, even though times are tight. And often it's when backs are against the wall that we do our best thinking and our and make best changes. So thank you for the spirit of that from everyone in the room. Thank you very much. And closing the meeting.